Hello, dear aspirants. Welcome you all to the Master Nursing classes. Myself, Mr. Nagraj, your Norcet mentor and guide, here in front of you all today to discuss the very important session for the upcoming exams of the nursing recruitment that includes the our Norcet 6 ESIC Nursing Officers exam and very importantly military nursing services and so upcoming all kind of the nursing exams that including the Rajasthan CHOs also there is huge vacancies are coming and so we will discussing the very important session daily students. So as all of you know that in the 6 p.m. daily on the master nursing classes, the live classes are streaming with a very huge important and clear concept questions, that is the questions with highest possibility to appear in your exams. We are discussing in the Let's Craft Norcet series. Students, yes, all we have completed two classes very successfully. This is our third class over the Let's Crack Norcet series. This class is going to be very important and true for your Norcet. So in this today's questions session, I have discussed the very important questions related to the renal system. Few questions that includes from the our renal calculi and urinary tract infection and the content of the vital signs, where I have discussed the very important questions and updated things and the most important questions that may arise us in the upcoming Narset exams. So in the today's sessions, that including the very fruitful and very clear with the golden multiple choice questions with a clear concept is in front of you students. Without wasting the time, we will start the class. Here is the first question for you all. Read the question carefully and try to answer for the question. Students, there is one beautiful and golden concept in the assessment of the pain that occurring due to the kidney problem. Okay, so here we will experience the two kind of the pain. One is renal colic, one is urethral colic. Okay, so two different pains we will experience in the different situations. So I will explain that one in this question. Okay, and so we are having the pain due to the yes the stone in the our gallbladder also, that is the characteristics pain. That one we need to assess and identify, very important, that will ask in exams. So sorry, so we will discuss in the today's this question. Okay, very important concept. This concept will definitely come in your exam. So read the question completely carefully and read all the four options and try to answer for this question, very important question. Okay, so sudden severe pain at the flank region. Okay, at the where the pain is occurring at the flank region. Okay, which radiates to the genitalia and thigh, indicates, yes, indicates dash. Yes, the option A is the renal colic. Is this indicating the renal colic? Option B is the urethral colic. Option C is the coliolithiasis. Option D is the abdominal colic. Okay. So what the word colic stands here? Colic is the simple thing where there is a sudden cramping pain occurring. Okay, the sudden sharp pain occurring in particular area, we call that is in the colic. Okay, so students, as in the question, there is a sudden severe pain at the flank region. First, we have to know where is the flank region located. Okay, I am drawing one simple diagram in front of you. Okay, this is our human body. Okay, so here is the thighs. Okay, and here is the upper extremities. So and this is the posterior part of the our body. Okay, here is the posterior part of the our body. Okay, posteriorly beside of the lumbar area. Okay, beside of the lumbar vertebra, we are having the, yes, the area that is what we call the flank region, where the our kidney is located anatomically. Okay, where our kidney is located anatomically, this area we call this is a flank area. If there is any problem or the pain which arises to the kidney problem, the pain arises in the this area, that is the flank area. Okay, so when the pain suddenly occurring in the flank area and the pain which is occurring suddenly, okay, which is radiating to the genitalia. Okay, which is radiating to the genitalia and the thigh. Okay, how the pain is radiating? The pain is radiating from the flank area to the genitalia to the thigh. Okay, so what is the condition where we will see this characteristics of the pain? Option A is the renal colic. Students, what happens in the renal colic? The pain originates from the our flank area only, but it radiates only to the genitalia in male, and which radiates only to the, yes, the our bladder in the female. Okay, so only if it is radiating to the genitalia in male and bladder in the female, so we call that is in the renal colic. Okay, we call that is in the renal colic. Okay, and if in case the pain is which is radiating from the flank area to the genitalia to the upper thigh, so we call that is an the yes the ureteral colic. Okay, ureteral colic. Hope the concept is very much clear for you all. Okay, the answer for the question goes to the option B, that is the ureteral colic. Why? Because of sudden pain, severe pain that is originated at the flank region and which radiates to the genitalia and thigh, means that is the ureteral colic. Okay, the renal colic occurs if the kidney stone present in the renal parenchyma in case of the nephrolithiasis. Okay, and the ureteral colic occurs when in condition where the renal stone is present inside the ureters of the renal system, where the stone moves downward. Okay, the pain moves downward. Keep remember the tricks. The stone moves downward and pain moves downward in the renal colic only up to the genitalia and the in male, and bladder in the female is radiating. And in the ureteral colic, here the stone moves downward. Okay, along with that the pain also moves downward up to the thigh. Okay, this is the how you keep remember this one. Okay, so then in what is the cholelithiasis, and how the pain characterized in the cholelithiasis. Choleo stands for students, as all of you know the cholecystitis. Yes, that is then yes the infection and inflammation of the gallbladder is the cholecystitis, where the cholelithiasis is the lithiasis stands as in stones here. Okay, so lithiasis, wherever the word lithiasis will come, that indicates the stones. Okay, the cholelithiasis is the stone in the gallbladder. Okay, where the gallbladder is located. Gallbladder is located in the right hypochondrial area. Okay, where the pain is appears in the right hypochondrial area. So that is the pain that may be due to the cholelithiasis. And if in case the pain which is present, which arising while taking the inspiration due to the pressure by the diaphragm on the right hypochondrial area, so that indicates the cholelithiasis or the cholecystitis. Okay, and then what about the abdominal colic? Yes, the pediatric situation, the word abdominal colic. Yes, anybody can know that one, students, where we have studied the breastfeeding. Okay, in the breastfeeding, all of you know that the mother milk is having the which protein? Yes, lactalbumin protein. That is very easily digestible to the baby. Okay, so we call that as a hair protein also for that one. Okay, so that lactalbumin protein which is present in the mother milk, which easily digestible to the baby. In some cases, in some villages, the mother will not give milk to the baby. In that condition, the co-parents of the baby, they will give the cow milk to the baby. Okay, so they are giving the cow milk to the baby. When the baby takes the cow milk, inside the cow milk there is one protein called the casein protein that will comes in your exam. Remember, the protein name is called as the casein protein. That casein protein is not easily digestible by the our baby digestive system. So at that condition, what happens? The pain suddenly which increases in the abdomen. Okay, so the stomach of the baby, where there is a sudden cramping pain in the newborns due to the casein protein of the cow milk, we call that is the abdominal colic. Hope the concept is clear. Okay, for all four options. And in this question, we have discussed the four questions that is very important for your all upcoming Norcet exams. Okay, so here's the next question. Very easy question. Read the question, understand the question, and response to the question. Okay, so here's the next question for you all. Which of the following are primary muscles of the inspiration? Yes, we are having the four options here. So among the four options, we need to identify those very important two muscles where which are primarily responsible for the taking the air inside our lungs. That is what we call the inspiration. Okay, so what the question is asking? Question is asking the yes the primary muscles of the inspiration. What are those two important muscles? We call those as the primary muscles of inspiration. Is this internal intercostal muscle? No, students. No, this is not a primary muscle of the inspiration. Where the primary muscles of the inspiration? Yes, can anyone answer for this question? Yes, very good. Who all are answering option C as the correct answer? So your answer is 100% right. Where the primary muscle of the inspiration of our diaphragm and external intercostal muscle. Okay, so external intercostal muscle and the diaphragm are our primary muscles of the inspiration. Very important. So what happens here? See, when there is a contraction of the diaphragm, okay, when there is a contraction of the diaphragm, when there is a contraction of our external intercostal muscle, our what we call the anteroposterior diameter and the transverse diameter of the lung will get increases. When there is an anteroposterior diameter and transverse diameter of the lung increases, there is a creation of the negative pressure inside the lung which sucks the air from the environment to the inside. So this is what we call the inspiration. Okay, so this is the actually an active process where the our muscles need to contract for the inspiration. Okay, very important. And the contracted muscles will get relaxes. When the muscles get relaxes and recoils, where the lungs again recoils the inside went air, it will come outside. That is what we call the expiration. Okay, and the expiration is a passive process. There is no need of the any energy for the expiration. Hope the concept is clear. Inspiration is an active process and expiration is a passive process. And how the normal inspiration occurs? Normal inspiration occurs due to the negative pressure which is created inside the lung. Okay, is this clear? Very good. Okay, then so what about the option A and option B? Option we are having internal intercostal muscle and option B is the anterior abdominal wall muscles. These two muscles are very important when you want to exhale forcefully. Students, I have told that the exhalation is a passive process. There is no need of the any muscles for the exhalation normally. So now I am telling that if you want to exhale forcefully, if you want to exhale forcefully means with your active attention. So at that point of the time you require two muscles, that is the internal intercostal muscle and anterior abdominal wall muscle. Hope the concept is clear. Okay, so if you want to forceful exhalation, these two muscles required. So then what about the sternocleidomastoid muscle? Sternocleidomastoid muscle, the muscle which is responsible for the turning right to left and left to left, right to left and left to right of our head. So very important muscle which originates from the sternum and goes up to the our mastoid. So this muscle you can palpate yourself. This muscle we call the sternocleidomastoid muscle. So this muscle is helpful for the forceful inspiration. Okay, so above said muscles are responsible for the forceful expiration, and the sternocleidomastoid muscle is, and the muscles scalene muscles, both muscles are responsible for the forceful inspiration. Hope the concept is very much clear. Okay, and for primary inspiration we are having the two muscles, that is our main muscle of the inspiration or the main muscle of the respiration only, you can say the diaphragm. Okay, and the external intercostal muscle. Very important two muscles. The examiner will ask the question from this one. Okay, with same concept like this only. Keep remember. Okay, here's the next question for you. Read the question carefully and try to answer for the question. Yes. Which of the following mechanism of the respiration is true except? Yes, you have to identify the true mechanisms except one. Okay, so there are given option. There are three things are correct and one is incorrect. You have to, yes, identify that one as an answer. Okay, so just now only I have told the inspiration is an active process. This is an, yes, the true mechanism. And expiration is a passive process. This is also a true mechanism. And students, we are having the two movemental mechanisms of the respiration where very nicely we have compared with the bucket handle movement and the pump handle movement. Very importantly, so what happening here? Yes, look at the images, look at the board. I am explaining slowly, nicely, completely. Okay, listen carefully. These two mechanisms definitely this time exams they will ask in your Norcet. Keep concentrated over the board. Students, this is the anterior part. First I will tell what is the bucket handle motion, and then I will go for the pump handle motion. Okay, so this is the our very nice diagram of the bucket. And okay, here is the our anterior part. Okay, the sternum, and here is the our posteriorly our vertebral column is there, and our beautiful rib which is connected posterior to the vertebra and anterior to the sternum. Okay, when we take inspiration, okay, when we inspire the air inside the lung, our lungs will get inflated, and when our lungs will get inflated, our ribs moves like the handle of the bucket, like this, students, upward and outward. Okay, upward and outward like this. Okay, so the upward and outward, our ribs moving like a handle of the bucket, we call this is in the bucket handle motion. Okay, when the lungs inflates and the our ribs moves like this, our our transverse diameter of the chest will increases. Okay, very very important, our transverse diameter of the chest will increases. Okay, hope the concept is clear. And here we are having the pump handle movement. Pump handle movement, this is the pump handle movement where we are having our sternum here. Okay, and so when we take the inspiration, when our lung inflates, so this sternum also moves upward and outward. Okay, this is the anterior part and here is the posterior part. Okay, when the sternum moves upward and outward like this. Okay, so what happening here, our anterior posterior diameter of the chest is increasing. Okay, our anterior posterior diameter of the chest increasing. Okay, so this is the posterior, this is the anterior. When the yes, the ribs moves like the pump handle motion. Okay, look at this one, this is the pump and this is the handle of the pump, where we will previously ancient still now also in the village areas we are using this pump handle for the removing the groundwater. Okay, so when we put the pump handle like this, the water will come like this only. When we'll raise the pump handle, it moves upwards outwards. Okay, it moves upwards outwards when there is a movement of the handle upwards outwards. Similarly, our ribs also moving upward outward, which increasing the anterior posterior diameter. We call that is on the pump handle movement. When there is an increase in the anterior posterior diameter and the transverse diameter, the lungs will get completely inflated and the negative pressure creates inside the lung. So the negative pressure which is created inside the lung will sucks the air from outside to the inside. So that is what we call the negative pressure mechanism. For happening of the negative pressure mechanism, our transverse diameter of the lung should be increased by the bucket handle movement, and our anterior posterior diameter of the lung should be increased by our pump handle movement. This is the very very important, you have to keep remembering in your mind. And come to the question, now read the option C and option D. Yes, option C is like this, bucket handle movement increases the transverse diameter of the chest. Very very true, very very true. And option D is like this, pump handle movement increases the transverse diameter of the chest. No students, pump handle movement increasing the, yes, comment pass, pump handle movement increasing the, very very good, anterior posterior diameter of the chest. These two mechanisms is responsible for the formation of the negative pressure inside the lungs, which sucks the air in from outside to inside, and the normal inspiration occurs actively. Hope the concept is very very much clear for you all. Okay, so this concept definitely, this bucket handle movement and the pump handle movement, there is a highest possibilities of asking the question from this concept this year. So do concentrate over the explanation. Okay, and here is the one incorrect mechanism. Yes, that is the option D is telling pump handle movement the increases the transverse diameter. Students, it will not increase the transverse diameter, which increases the anterior posterior diameter. So answer for the question goes to option D as the correct answer. Hope the concept is very very much clear for you all. Okay, and here is the one more beautiful question from the respiratory system. Yes, solve the question. Read the very very easy and basic question that you have all have studied in your first year of the BSc nursing or the GNM nursing in the anatomy physiology. Yes, the internal respiration occurs between. Yes, the internal respiration occurs between the. Yes, students, we are having the two kind of the respiration. One is the internal respiration and another one is the external respiration. Yes, option is the environment and lungs. Option B is the lungs and bloods. Option C is the blood and tissue. Option D is all the above. Yes, I am waiting for your answers for this question. Yes, try to answer very very easy and basic question. Yes, try to answer for the question. What happening, students? Okay, look at the explanation. So this is the alveoli of the lung. Okay, the structural and functional unit of the lungs is the alveoli, and here is our blood is coming from the our pulmonary aorta for the oxygenation. Okay, and the deoxygenated blood which comes from the pulmonary aorta to the lungs for the oxygenation. So our lungs from the environment, it will take the oxygen inside. Okay, and so the oxygen will come inside. Here is the blood comes with the deoxygenated, the carbon dioxide rich blood to the gas exchange to the lungs. Okay, this point, okay, where the carbon dioxide goes to the alveoli and the oxygen comes to the our very beautiful blood, okay, and the oxygenation process of the blood occurs here by exchanging the gases. The carbon dioxide will go to the lungs, and from the lungs to the environment, and the oxygen comes from the environment, and from the environment, from the lungs alveoli to the, yes, to the blood. When there is a gas exchange between the alveoli and or the lungs and blood, we call this one as an, yes, the external respiration. Very very importantly, we call this one as the external respiration. Now the oxygenated blood which will comes to our, yes, the beautiful heart, okay, so beautiful heart with by the our pulmonary veins, okay, so pulmonary veins brings the oxygenated blood to the left atrium, from the left atrium to the left ventricle, from the left ventricle to the aorta, aorta to the entire body, okay, aorta to the all the tissue, peripheral tissue, where there is a cell in there in the periphery with metabolized function with rich carbon dioxide, and now oxygenated blood is coming, okay, the oxygenated blood is coming. This oxygen and nutrients which goes to the cell, and the carbon dioxide from the cell to the our oxygen, what we call the blood vessels, it will comes in the periphery. This is in the inside between the tissue and blood, what the respiration gas exchange occurring, this is what we call the internal respiration. Very very importantly, keep in your mind, the internal respiration occurs between the, yes, the blood and tissue, and the external respiration occurs between the lung and blood. Very very important to keep in your mind, okay. Hope the concept is very clear. The answer for this question goes to the our, yes, option C, that is the blood and tissue. Who all are giving the answer as a B, please correct your answer. This is the option answer as in C, because the internal respiration occurs between the tissue and the blood, and the external respiration which occurs between the our lungs, alveoli, and our blood. Okay, hope the concept is very very much clear for you all. Okay, let me go for the next question. Here's the next question. Yes, try to answer for the question. Very basic question, very important question. Okay, which of the following is a reason for the high incidence of the urinary tract infection in the female? So why there is almost all patients which comes with the urinary tract infection are so female? Is there is any anatomical reason? Is there is any scientific reasons? Yes, there is some anatomical structural reason, and there is some scientific reasons where there is highest incidence of the urinary tract infection. We will mostly seen in the females. Why? Because their urethra is very much short. So what is the length of the female urethra? Length of the female urethra is only and only 4 centimeter, students, where there is a length of the male urethra. So the length of the male urethra, you can remember, okay, very very important one. The length of the male urethra is the 20 centimeter, and the length of the female urethra is only and only 4 centimeter. So there is highest risk of the bacteria to get entry into the renal system very easily because of the short urethra. So there is highest incidence of the UTI in the female. Okay, one concept is clear, and option A says yes. Yes, option A says yes, the short urethra, which increases the highest risk for the, yes, the infection in the female, and option B says the urethra opening near and anterior to the anus. Very very important, students. So where there is an anal opening is there, and so here is the our like the perineum of the female, where there is an anal opening. Beside of the anal opening, in the anterior part of the anal opening, only our vaginal opening, and near to the vaginal opening there is an urethral opening is there. So this urethral opening, which is very very near to the anal canal as compared to the female, and where there is a contamination which increases the risk of the urinary infection in the female. Very very important. One more concept. Okay, and the urethral opening is anterior to the anal opening and not posterior to the anal opening. Keep in your mind. Okay, so the option C says the urethral opening is posterior. No, it's anatomically not posterior. Anatomically, it is anterior to the our anal opening. Okay, and the answer D is the A and B both correct. Yes, the option answer for this question goes to the, yes. Who all are given the answer D as correct answer? Very good, students. So this is how we will learn simple things. This is how we will build our concept. This is how we will crack our Norcet exam, students. Very very important. Who all are given the option D as a correct answer? I am saluting you all through the master nursing classes. Your concepts are very clear. Your consistency is very good. So because of that only you are giving the so difficult questions as on good answers. So I'm saluting through the master nursing classes. Very good students. Keep it up. Keep it up. This is the thing which makes you a champion. Okay. Here's the next question for you all. Read the question carefully and try to answer for the question. Yes. Option questions are is like this. Is the normal lung breath sound heard all over the chest wall is dash? Yes. The question. What is the question? The normal lung breath sound heard all over the chest is dash. What happening here? Okay, students, we are having our very beautiful lung like this. Okay, this is our trachea. Okay, and here is our right bronchi, and here is our left bronchi. Okay, and here is our beautiful lung with the yes, the right side lung with the three lobes, and in the left side lungs we are having the only two lobes. Okay, so here is the trachea, here is the our lungs. Okay, and this is the bronchi where the yes our trachea it will comes with the semi-circular rings. The number of the rings the examiner will ask, that is the 16 to 20 rings will be there. Okay, and here is the divide point of the right and left trachea. There is an one point we call that is in the carina. Okay, and this is the right lung with three lobes, and this is the left lung with the two lobes. And if the examiner asking how many fissures we are getting in the right lung? Yes, the fissures are the in the right lung two fissures. Okay, fissures are the yes the dividing point of the lung. Okay, which is dividing one and which is dividing two. So there are three lobes and two fissures present in the right lobe lung, and in the left lung there is an two lobes and only one fissure is there. Okay, that is the oblique fissure. Okay, very important. So here is the our lungs. When we keep the stethoscope to hear the lung sound, okay, to the entire lung fields, entire chest wall, we will hear the vesicular sound as a normal lung sound in the entire lung field is the our vesicular sound. Whatever the sound we will hear in the entire lung fields, okay, that is the vesicular sound. Okay, this is the vesicular sound here. It will come. Okay, if in case we will keep the stethoscope over the our trachea, we will hear the very beautiful bronchial sound. Very important students. The bronchial sound is not heard on the bronchi of the lungs. It will be heard on the our trachea of the respiratory system. Very important. Keep in your mind vesicular sounds comes entire lung filled, and the bronchial sound which comes over the trachea of the respiratory system, where the examiner will try to ask the question and confuse you all. Okay, where the bronchial sound heard in option you will get the bronchi also as an option, but the answer is not bronchi. The bronchial sound you will hear on the trachea of the patient. Keep in your mind, very important. Okay, if in case the bronchial sound coming entire lung field means that indicating the pathology, that indicating the some pulmonary problem is there. The main pulmonary problem where we will hear the bronchial sound over the entire lung fields is the lung fibrosis. Okay, very important. Keep in your mind. Okay, so where will in which condition we will get the crackles and crepitation? What is the crackles and crepitation? Yes, let me tell. So take one bucket or bowl. Okay, so fill with water. Okay, put on pipe, and so push the air inside this pipe. Okay, what are the sound which will comes as a bubble sound? So that sound we will consider as a crackle sound or crepitation sound. Similarly, also in the situation where there is yes the lung fields, the lung parenchyma yes get filled with the fluids as a pulmonary edema. Okay, in condition of the pulmonary edema, whatever the gas will comes, it will pass with the fluids and the thick mucus or thin mucus membrane. Okay, where we will hear the crackles and crepitation. Especially this the crackles and crepitation we will hear in case of the left heart failure. Students, very important. The crackles and crepitation we will hear in case of the left heart failure. Your mains exam question. Keep in your mind repeatedly. These questions may ask many times. Okay, the crackles and crepitations we will hear in the left heart failure. How means yes. Let me explain. I will explain in detail. Don't worry. So see, this is the our beautiful lungs. Okay, and let me take a diagram first. Okay, so this is our beautiful lungs with the two lobes of the heart, and here is our beautiful heart. Okay, so this is our beautiful heart. So as all of you know, from here there is an aorta originates from the yes our right ventricle, and it goes for the oxygenation to the lungs. Okay, when it will get oxygenated, so the pulmonary veins which will get the bloods to the our left side of the heart, that is to the left atrium. Okay, to the left atrium, the oxygenated bloods will come from the our lungs. Okay, what we oxygenated blood will come from the lungs to the left atrium, and deoxygenated blood which goes from the our very important our right ventricle to the our lungs. Okay, through the pulmonary artery, where the only one artery which carries the deoxygenated blood is the pulmonary artery, and the only one vein in the body, okay, which carries the oxygenated blood is the our pulmonary vein. Okay, hope the concept is clear. Okay, when there is then failure of the left ventricle, when there is then left ventricle fails to contract, the blood will accumulate here, and the blood will accumulate here means the pressure will create here. When the pressure will create here, and the pressure will create on the our pulmonary veins also. When their pulmonary veins get congested, the fluid starts accumulating in the lungs. When there is a fluid start accumulating in the lungs, we will hear the we will hear the which sound. When the fluid accumulates in the lung, we call that is the pulmonary edema. In the pulmonary edema, due to the left side heart failure, due to the left heart failure, so that sound we call as in the crackles. Okay, so crackles are the crepitation where we are hearing in the left heart failure. Okay, and wheezing and the ronchi are the sound where which occurs due to the the passage of the air in the constricted bronchitis, where we will see in the wheezing and bronchi as an is the classical picture of the asthma disease, where there is a sudden and severe allergic reactions which are constricting the bronchus, the smooth muscles of the bronchus. So where there is an taking the air inside, which creating the sound, music like sound, we call that is in the wheezing or the ronchi. We will hear the special this sound in the asthma. Very important. Four questions I have explained with the normal lung sounds and the abnormal lungs sound we will hearing in the as the condition with the left heart failure, and the wheezing is the classical picture of the asthma. Hope the concept is very much clear. Okay, this question definitely asked this concept what I have explained, four concept in this single particular one question. So this concept definitely comes in your upcoming next Norcet exam. Keep remember, after giving the exams, come and tell in the comment box, sir, these questions with the same concept which asked in our Norcet 6. Okay, so here is the next question for you all. Read the question carefully, completely, and try to answer for the question. Yes, the question is like this: inappropriate nursing education, any patient undergoing the intravenous pyelography. Yes. So can anyone tell why we will do the intravenous pyelography? Yes, what is the intravenous pyelography? Intravenous pyelography is the very simple thing where in the veins we are injecting the dye. Okay, when this dye will go to the renal system through the circulation, at that point of the time we will take the ultrasonography of our renal system to know that where is the actual anatomical structural problem is there, and the stones and all get obstructed, we will get to know when we will inject the dye. And so we will do the ultrasonography through the intravenous pyelography, where we are taking the series of the ultrasonographical radiological film of the renal system after injecting the dye. That is what we call the intravenous pyelography. Okay, so in short form we will call that is in the IVP. Okay, IVP, where we are injecting the dye to the patient through the veins. Okay, so what is the inappropriate nursing education, any patient undergoing to the an intravenous pyelography? Yes, try to read the all questions and try to answer for the question. Option A is the increased oral fluid after the procedure. Option B is the metallic taste, flushing, throat irritation during the procedure indicates the contrast toxicity. Option C is it's contraindicated in pregnancy. Option D is yes, kidney function test should be normal before doing the test. Yes, what is the inappropriate one? Nursing education. Identify among the given all four options. Yes, let me explain. Students, so as I told, we will give the contrast dye, so intravenously. Because of that, after completing our intravenous pyelographic procedure, okay, in order to eliminate the dye through the renal system, we will ensure the patient to increase the oral fluid. Okay, after the procedure, in order to eliminate the contrast, in order to eliminate the dye we are injected through the veins. So that is the very important nursing education, and this is the appropriate nursing education. Okay, and option B telling metallic taste, flushing, throat irritation during the procedure indicates the contrast toxicity. No, students, no. Why? Because Why? Because this is the normal thing which occurs. Normal thing which occurs when we inject the contrast to the uh, patient who is undergoing the IVP procedure, where we will inject the contrast. So that contrast may normally creates the metallic test, normally creates the flushing, means the sudden blood flushing of the face and all, where there is a redness of the face occurs, okay, throat irritation, and some kind of the dizziness which occurs. Yes, that is due to the normal and normal, that is not indicating the any toxicity. So we need to educate the patient. So after giving the contrast, you will feel some metallic taste in your body, mouth, and you will feel some flushing like redness of the face, and you will feel some throat irritation. And after the procedure, your urine color may changes. This is the absolutely normal. The patient, whoever he may be taking the intravenously dye, this is the absolutely normal. It does not indicating the contrast toxicity. Students, where there is a contrast allergy occurs. So how the allergy occurs? There is sudden severe rise in the fever. There is sudden hives formation, the sudden rashes formation all over the body, and the suddenly respiratory difficulty occurring, that indicating the contrast allergy, where there is no any contrast toxicity which indicating due to this given history. Okay, so we need to educate the patient. This is the normal thing in order to decrease the anxiety of the patient. Okay, where in this option they are telling the toxicity. So this is the inappropriate nursing education. And so what may the other questions will ask from here? So it's very important. They will ask the nursing responsibilities in the patient who is taking the dye, where the nursing responsibility goes to the, we need to ensure that with the kidney function test should be normal. Why? Because after giving the dye will eliminate from the kidney only. If the kidney function test is not normal, kidney is not functioning properly, the dye will remains in the body only, which damages the other vital organs. Very importantly, we need to focus. We need to verify the report of the patient before doing the before injecting the contrast, that the kidney function test should be normal. Means the creatinine should be in the normal level, the blood urine nitrogen should be in the normal level, the uric acid should be in the normal level. Then only we will proceed the patient for the, yes, the injection of the dye. Okay, so and very important. And before giving the contrast, we need to ensure that the patient should be not allergic to the any kind of the iodines, any kind of the dyes, any kind of the contrast, any kind of the seafood. It is very important to identify and recognize and ask the patient whether you have had the previously any kind of the allergy. If the allergic to the or seafood, allergic to the contrast dye, or allergic to the very importantly iodine, so that indicating the patient is having the allergic. So we will not inject the dye, we'll cancel the procedure. Okay, so very importantly, before doing the procedure, we need to assess the history of allergic history, and assess for the, yes, the allergy for the all of whatever I told. And very importantly, we need to ensure that the renal function test should be normal before doing the this one, what we call the intravenous pyrography. And in the pregnancy, the injection of the contrast, all kind of the contrast is contraindicated. So the option C also correct one only, appropriate education only. The if the lady is pregnant, so we will ask the pregnancy history before injecting the dye, because the injection of the dye in the pregnancy is the contraindicated. Okay, hope the concept is very much clear. The all possible arising questions I have told in this question. So the questions will comes in the this style only, this manner only, this proper techniques only. So remember the concept, that helps you to clear the questions. Okay, so here is the next question for you all. Read the question carefully, completely, and try to answer for the question. Yes, read the all options correctly. The expected management in a client with a 3 centimeter stone in the renal parenchyma. Where is the stone is present? Students, if the stone, okay, if the stone, okay, which is present inside the kidney, okay, inside the kidney, means we call that is in the nephrolithiasis. And if in case the stone which is present inside the our ureter, we call that is in the urolithiasis. Okay, so this is the kidney stone which is present in the renal parenchyma. We call this is in the nephrolithiasis. Means nephro stands here as the kidney, and lithiasis stands here as the stone. So this one is the nephrolithiasis, and here the urolithiasis means uro stands here as the ureter, and lithiasis stands here as the stone. So the stone is present in the inside the ureter. We call that is in the urolithiasis. Very important. Keep in your mind. Okay. So when there is urolithiasis, another one complication arises due to the urolithiasis. This urolithiasis will blocks the uretral renal outflow. So where there is an accumulation of the fluid distal to the proximal to the our what we call the stone. So the accumulation of the urine in the renal pelvis, we call that is and the we call that is and the very important. Yes, can anyone tell that one? Very important. That is the hydronephrosis. Okay, or we say hydrouretrus. Okay, hydrouretrus means the water is or the urine is accumulating in the uretrus and the kidney. We call that is in the hydronephrosis or the hydrouresis. Very important. Keep in your mind. Okay. So what the examiner is asking? So what is the management? Management when the stone size in the 3 centimeter. Okay. So the examiner asking the expected management when the stone size is 3 centimeter. Okay, let me clear your build your concept here for solving the all these questions. Okay, if in case size of the stone is only 5 mm. Okay, so we will follow the conservative management, where in the conservative management only we will focus on the excessive hydration of the patient, and only we will focus on the controlling the pain, where the painkiller. Okay, and hydration of the patient will maintain, where the stone will come out due to the overhydration. So the conservative management goes, the stone size is yes the less than 0.5 mm, not centimeter. Students, keep in your mind. Okay, not 0.5 only. So I will remove the 0, otherwise you will get confused here. Okay, so if it is less than 5 mm, okay, if it is less than 5 mm, our management goes to the conservative management. In the conservative management, we are focusing over the hydration, and we are focusing over the pain management, and the priority management goes in the patient with the renal colic, or the patient with the very important the kidney or the flank pain. So the priority goes to the controlling the pain only, not hydration. Students, where the priority nursing responsibilities in patient with the renal colic or the renal stone or the uretral stone. So the priority always goes to controlling the pain, and the pain controlling managements and the interventions takes the priority in the patient with the renal pain. Okay, very important. So the next what happens? Okay, if in case the stone size is 1 minute, students, please. If in case the stone size is less than 2 centimeter, okay, we will go for the yes, the extracorporeal shock wave lithotripsy. That in short form we call that is in the ESWL. The ESWL full form is the extracorporeal shock wave lithotripsy. Students, wherever the word comes as an extra corporeal, okay, extra corporeal. So this indicates the yes the outside the body. Okay, outside body. Okay, very important. So wherever the word, it will takes the extracorporeal, that indicates the outside the body. Okay. Other example, like if I can give, means extracorporeal membranous oxygenation. Okay, that is the ECMO. All of you know that, where we are using the heart lung machine, where we are taking the entire blood outside and we are oxygenating the blood. So that is what we call the extracorporeal membranous oxygenation. So extracorporeal means we are doing something outside the body. Means the ESWL is the non-invasive procedure. We are not taking any incision. We are not doing any cut over the patient body. We are giving the high intensity shock waves over the stone, where the stone is breaked into the fragments. Okay, the stone is breaked into the fragments. Okay, after that we will insert one large stent inside the urethra, where the stones will comes from the stents to the outside. Okay, this procedure we call as an extracorporeal shock wave lithotripsy. We will use this mechanism when the stone size is less than 2 centimeter. Okay, if in case the stone size is more than 2 centimeter, if in case the stone size is more than 2 centimeter, okay, so we will use the yes the percutaneous nephrolithotomy, where we are cutting the cutaneous skin over the flank area. Okay, and after that we are giving the shocks and breaking the stone from the our nephrolithosis condition. Okay, and after that the stones will come through the same stent. So if you are taking the incision and breaking the stone, means we call that is in the Yes, the percutaneous nephrolithotomy. And if you are outside the body, we are inducing the high intensity shock waves and breaking the stones into fragments. We call that is the extracorporeal shock wave lithotripsy. Very, very important. Keep in your mind. So here is the stone size is 3 centimeter, means it is more than 2 centimeter. So we can say the answer as in option C, that is the PCNL, that is the percutaneous nephrolithotomy is the expected management in a client with the stone is, yes, our 3 centimeter. Okay, hope the concept is very much clear. Okay, so this is the how you have to know the, yes, the management of the kidney stone. Okay, here is the next question. So very important and easy question for you all. Read the question carefully and try to answer for the question. Students, before solving this question, here is the one more question you have to solve. So let me take that question first and then we will come for that question. Okay. So 1 minute, please. Yes, here is the question. So you can solve this question, and after solving this question, we will go for that one because the both are in the sequence. Okay. Yes, read the question carefully, completely, and try to answer for the question. Which of the following anti-cancer drug causes the hemorrhagic cystitis? Yes. What is the hemorrhagic cystitis? So when the person who is suffering from the cancer, who is taking one anti-cancer drug, so because of the side effect of that anti-cancer drug, there is and the bleeding from the there is a bleeding from the bladder. Bleeding from the bladder, we call that is the hemorrhagic cystitis. Hemorrhagic means the bleeding. Cystitis means the inflammation of the bladder. Okay, due to the inflammation of the bladder, there is bleeding from the bladder. We call that is the hemorrhagic cystitis. So which anti-cancer drugs which causes the hemorrhagic cystitis? So that is our the cyclophosphamide. Cyclophosphamide is the drug which is responsible for causing the our hemorrhagic cystitis by creating the inflammation of the bladder. So we call that is the hemorrhagic cystitis. Very, very important. This question may ask in your exam. And one more anti-cancer drug we are having is the vincristine. So this is the side effect of the vincristine. That is the side effect of the vincristine is the SIADH. That is the syndrome of inappropriate antidiuretic hormone is the side effect of the vincristine. And the busulfam is the anti-cancer drug which causes the lung fibrosis, So students, very, very importantly, we are having the three drugs which causes the lung fibrosis as a side effect. So all the three drugs may repeatedly ask in the exam related to the lung fibrosis. Where the busulfam, okay, and where the another one is the amiodarone, okay, amiodarone, okay, busulfam, amiodarone, and the bleomycin. These three drugs which repeatedly, okay, causes the lung fibrosis when the patient takes the drugs. So we need to assess the function of the both lungs expansion together. So we will assess the how we will assess the lung fibrosis. We will assess the expansion of the chest with symmetry, means the both chest should inflate simultaneously, similarly, and it will go deflate. So this is the how we will assess the chest symmetry. If the one lung is expanding, another lung is expanding slowly, means there is possibilities of formation of the some fibrosis, that indicating the toxicity of the our busulfam, that indicating the toxicity of the patient who is taking the amiodarone. And in the bleomycin, there is highest possibilities of formation of the lung fibrosis. The examiner asked the question from the this concept repeatedly. Okay, but the our question is like this: where the which of the following anti-cancer drugs causes the hemorrhagic cystitis? The hemorrhagic cystitis is caused by our cyclophosphamide. So the next question is like this: is the drug used to prevent the hemorrhagic cystitis by detoxing the cyclophosphamide? Yes, read the question carefully. Where the we all got know that the when the patient who is taking the cyclophosphamide, he will get the hemorrhagic cystitis as a side effect. So in order to prevent the hemorrhagic cystitis, we need to detoxify the cyclophosphamide immediately after its action. So which medication you will give to detoxify the, yes, cyclophosphamide. So that is the mesna. Mesna is the injection will inject to the patient in order to detoxify the cyclophosphamide and decrease the incidence of the hemorrhagic cystitis. So very important. Due to the cyclophosphamide, hemorrhagic cystitis occurs. So the another one drug we will give to prevent the hemorrhagic cystitis. That is the mesna. Okay. So very important. And here is the option B is the N-acetylcysteine. All of you know this is the antidote of the paracetamol. Okay, it's an antidote of the paracetamol. And option C is like this: deferoxamine or the desferoxamine. Yes, this is the antidote of the iron overload. Okay, if the body is overloaded with the iron, okay, if the body is overloaded with the iron, we use the deferoxamine. Ferrous sulfate iron. You know that is the same thing. Okay, deferoxamine or the desferoxamine is the medicine we will use to treat the iron overload, and dimarcaprol is the thing where the medicine we will give to treat the toxicity of the lead poison. Students, very important. Yes, the which drug we will giving to treat the lead poison? That is the dimercaprol. In the iron overload, deferoxamine. In the PCM, N-acetylcysteine. To prevent the hemorrhagic cystitis by detoxifying the cyclophosphamide, that is our mesna. Mesna is the medicine we will give to treat the hemorrhagic cystitis. Very important question that may comes in your exam directly with same concept, students. Here is the next question. Yes, try to answer for the question. Very easy and basic question for you. Yes, the normal respiration rate of the newborn. All of you, 100% I am sure that all of you will give the correct answer for this question. This is the way, kind of the very simple questions where there is 99.9% of the aspiration will give the correct answer, where the 1% aspirants who will not read the questions and who will not read the options carefully, where they will give the wrong answer, and the rank of those students will go the 300 to 400 ranks will go away. So students, very important. So making the difficult question correct answer is not important. Giving the correct answer for the simple question, that makes a very much difference. Why? Because students, there is only least students who makes the mistakes in the simple questions. So always don't neglect any simple question in your exam. Take every question as a good question. Take every question as a serious question. Read the question carefully. Read all the options carefully and try to answer for the question, where your ranks will always flow in the top students. Okay. So the normal respiratory rate of the newborn is, all of you know that, yes, the option A, that is the 30 to 60 breaths per minute. If the examiner wants only one value, means we can give as an 40 breaths per minute is a standard value, where we will consider as in the normal respiratory rate of the newborn. Okay. And 12 to 20 is the normal respiratory rate of the our beautiful adults. Okay. So hope the concept is very much clear for this question. Okay. And here is the next question: the most common type of the kidney stone is. Yes, can anyone answer for this question? A somewhat next level question. The most common type of the kidney stone is. Option A is the calcium oxalate stone. Option B is the calcium phosphate stone. Option C is the triple phosphate stone. And option D is the uric acid stone. Students, I will discuss all kind of these stones in detail, where you will get to know all the possible questions and how you will solve these questions in your exams. So when the examiner asks the most common type of the kidney stone. So the most common type of the kidney stone is our calcium oxalate stone. Okay, so the calcium oxalate stone, is this question directly comes like this in your aims? No, students. Then how the examiner will ask the question, sir? The examiner will ask the question. So where is the highest possibilities of the formation of the calcium stone? If the patient is suffering from the hyperparathyroid hormone, where there is the parathyroid hormone is increasing, so which brings the calcium from the bone to the blood. Okay, which brings the calcium from the bone to the blood. Okay, where there is in the blood there is hypercalcemia. Okay, due to the hypercalcemia, okay, there is the calcium goes and accumulates in the what we call our kidney. So where there is a super saturation between the kidney, okay, kidney chemicals and the urine and the calcium and the oxalate, where there is a formation of the calcium oxalate stone. So we call this one as the most common type of the kidney stone. Okay, the very highest risk is in the patient who is having the hyperparathyroidism. Okay, so the patient who takes the much more of the red meat, and who takes the repeatedly drinks the alcohol. Okay, and especially the red wine. Okay, alcohol, and especially the red wine. Okay, red meat, alcohol, red wine, mushroom. Okay, so we will take this one as a repeat as in regular food where there is an highest purine food they are eating. Okay, the highest purine food which metabolizes and the forms the uric acid. Okay, so when this uric acid which get accumulates in the joints, we call that is in the gouty arthritis. Okay, and when this uric acid get accumulates in the kidney, where there is an highest risk of the formation of the uric acid stone. Very important, keep in your mind this stone they will ask in the exam repeatedly. And so in this stone there is a special smell of the urine which will comes as an, yes, the rotten egg smell urine which comes in which stone. Yes, that is the characteristic features of the uric acid stone. Here, there, the examiner, if the examiner is asking the most softest stone, the most softest stone is also an uric acid stone. And in where which condition the, yes, the rotten egg smell of the urine will come. That is comes in the uric acid stone. Okay, and the calcium oxide stone is the most common type of the stone, where there the uric acid stone we will see in the patient with the who is taking the highest purine. Okay, and the patient with the hyperparathyroidism we will get the, just the most of the calcium oxalate stone. Okay, so then what are the risk factors we will discuss in the next question here only. Okay, so and we are having the calcium phosphate stone. The rarest stone is the calcium phosphate stone. Okay, and the triple phosphate stone. So another name of the triple phosphate stone we are having, we will in triple phosphate stone we will also called as in the Strangham stone, and we will also called as in the, yes, our Struite stone, Strangham stone, and very importantly post infection stone. Okay, so this triple phosphate stone which mainly occurs due to the protease infection, where there is a protease bacteria which converting the our urea into ammonia. Okay, due to the presence of the urease in the protease bacteria, so there is increased ammonia phosphate. Okay, so supersaturation between the ammonia phosphate and our magnesium phosphate and our plain phosphate, which leads to the formation of the triple phosphate stone. So that is the stone we also called as the Stroite stone, infectious stone, and the Stangham stone and the triple phosphate stone. So the all four names is there for only one kind of the stone, that is our triple phosphate stone. Very important. Keep in your mind which stone occurs after the protease bacterial infection. The stone name is called as the triple phosphate stone. Okay, hope the concept is clear. And the dangerous type of the stone is the our triple phosphate stone, also called as the Struite stone. Why? Because the edge of the stone is the very sharp. When the stone moves inside the renal system, the stone which damages the surrounding tissue mucosa and which leads to the bleeding. When there is a stone which damaging our organs, we call that is the dangerous type of the stone, that is the triple phosphate stone. Okay, and the uric acid stone is the softest stone. Okay, which is like a cotton sponge. Okay, that is the uric acid stone. Hope the concept is very much clear for this question. We will move for the next question. Here is the next question for you all. Read the question carefully, completely, and try to answer for the question. The most common cause of the urinary tract infection. Very easy. All of you give the correct answer. So I will not waste much time here. Yes, all of you have given the, yes, very good. That is the E. coli is the most common cause for the urinary tract infection is the E. coli. And if in case the examiner asking the most common cause for the pyelonephritis, also the same answer, that is the E. coli. Okay, so very important. Keep in your mind. Okay, so here is the next question. Yes, read the question carefully, completely, and try to answer for the question. So the clinical manifestation of the urinary tract infection includes all except. Okay, includes all except. So option A is the, yes, the dysuria, dysuria and burning micturition. Yes, the patient who is having the infection of the urinary tract, so that is an upper urinary tract or the lower urinary tract infection. When in condition, both the condition where we the person feeling the painful in the passing urine, so we call that is in the dysuria. And so the some burning sensation while passing the urine, so we call that is in the burning micturition. Okay, so this is the clinical manifestation of the UTI. Okay, and there is an increased frequency and urgency in the urination. Yes, absolutely, this is also in the clinical manifestation of the urinary tract infection. And when there is a foul smelling and the change in the color of the urine, this is also a classical picture of the urinary tract infection. Where the decreased WBC count, upper abdominal pain. No students. Where there is, if in case of any infection, the WBC count will get increased, and especially if in case of the urinary tract infection, there is lower abdominal pain is there, not the upper abdominal students. So the except one goes here as an option D. Yes, all are given the option D as a correct answer. Very, very good. Keep the same, continue. This is the thing which brings you a very important and 1 mark. This 1 mark brings your, yes, the rank in the top 100 students. So the answer for the question goes to the option D. Okay, so here's the next question for you all. Read the question carefully, completely, and try to answer for the question. So what is the investigation of choice for the nephrolithosis? So just now in the previous questions only we have discussed what is nephrolithosis. If that is the stone in the kidney. Okay, stone in kidney, we call that is a nephrolithosis. Okay, so the examiner is asking what is the investigation of choice. If the asking the primary or the first investigation is the X-ray KUB, and when we are doing the KFT or the renal function test or kidney function test as a routine, so this is not an investigation of choice. So if the examiner is asking the investigation of the choice, where the IOC stands for investigation of choice in patient with the nephrolithosis, is the, yes, our CT abdomen is the investigation of choice for our, yes, very important nephrolithosis. Keep in your mind. Okay, so there is a chance of the coming this question also. And the next question is the infection and inflammation of the bladder is known as. Okay, so what the term we will use to describe the infection and inflammation of the bladder? So the infection of the inflammation of the bladder, we call that is in the cystitis. Yes, all of you have given the correct answer. There is the option B. The cystitis is the term we will use to describe the infection and inflammation of the bladder. Okay, so then what about the pyelonephritis? Pyelonephritis is the condition where there is in the, yes, the kidney and the renal pelvis. So students, so this is the renal parenchyma, and so this is the renal pelvis. Okay, where there is an infection, inflammation, and accumulation of the pus in the renal pelvis and the renal parenchyma. So we call that is in the pyelonephritis. We call that is in the pyelonephritis. Okay, the most common cause for the pyelonephritis is an again E. coli. Okay, again E. coli is the most common cause. Okay, so then what about nephritis? Nephritis is the only infection and inflammation of the kidney. We call that is a nephritis. We will study the various type of the nephritis like glomerulonephritis, post-streptococcal glomerular nephritis. We will study each and everything in the next upcoming session. Okay, and option D is like urethritis, where there is an infection and inflammation of the urethra, where the in the male there is an, yes, the release of the foul smelling, yes, the mucopurulent discharge from the penis urethra. We call that is then the infection and the inflammation of the urethra. So that is the urethritis. Hope the concept is very much clear for this question. Okay, here is the next question. Read the question carefully, completely, and try to answer for the question. Yes. So who all are given the option B as the right answer for the last question. So this question is the very correct. Okay, so here is the next question. Read the question carefully, completely, and try to answer for the question. So sorry, here is the spelling mistake. So this is the same. Which of the following word is used to stone in the ureter of the renal system? So just now only in the previous class we have discussed. So we will not waste much time over this question. Okay, so if the stone is present in the, yes, our kidney, we call that is in the nephrolithosis. If the stone which is present in our ureter, okay, stone in ureter, we call that is in the urolithosis. Okay, stone in kidney, we call that is in the nephrolithosis. If in case of the, yes, the stone in the gallbladder, we call that is in the cholelithosis. Okay, if the stone is in the gallbladder duct, we call that is in the choledocolithosis. Very, very important 4 terms. Okay, keep in your mind. So which of the following word used to stone in the ureter? Okay, stone in the ureter means that is the urolithosis. Stone in the kidney means nephrolithosis. Stone in the gallbladder means the choleolithosis, and the stone in the gallbladder duct means that is the choledocolithosis. Hope the concept is very much clear for this question. The 4 terminologies were repeatedly asked in our previous exams. So I have brought this question in front of you to solve the 4 terminologies in the single question. So hope the concept is clear for this question. Okay, so here is the next question for you all. Read the question carefully, completely, and try to answer for the question. Yes. which of the following condition keeps the person highest risk of the kidney stone? Very, very important. So what are the, we are having the few conditions as in risk factors in the options. So what are the conditions which keeps the person at the highest risk of the, as the kidney stone? So almost 2 3 points we have discussed while discussing the previous questions. Okay. So immobilization, very, very important, students. Where there is, if the patient is prolonged immobilization, if the patient is prolonged bedridden, so his bone will starts to deteriorate. When his bone will start to deteriorate, the calcium from the blood to the bone to the blood, it will come where there is an hypercalcemia. So this hypercalcemia, so when there is an accumulation of the calcium in the kidney, which leads to the supersaturation between the urine, kidney, and oxalate. So urine, calcium, and oxalate, which forms the calcium oxalate stone. So this is the most common kidney stone which arises due to the immobilization of the patient, or the patient who is prolonged bedridden and staying in the ICU. Also, there is highest risk of the calcium oxalate stone. So immobilization is the great, keeps the person in the greatest risk of the, yes, the kidney stone. And the option B is the protease bacterial infection. As I told that the protease bacteria is having the enzyme, that the enzyme is the urease enzyme. Okay, this urease enzyme, so which converting the our urea to the ammonia. Okay, which converting the urea to the ammonia, where there is an increased ammonia. Okay, which gets super saturates with the magnesium sulfate, magnesium phosphate, phosphate, and ammonia phosphate, which leads to the formation of the triple phosphate stone, or the Struwite stone, or the Strangham stone, or the post-infectious stone. So that is the protease bacteria also keeps the person in the highest risk of the kidney stone. Okay, and the hyperparathyroidism, where there is in the hyperparathyroidism, increase parathyroid hormone, increases the blood calcium level. So again, which there is a highest chance of the, yes, the calcium phosphate stone or the calcium oxalate stone. And in the gouty arthritis, where there is an excess increase in the uric acid. Okay, so this uric acid may get accumulates in the kidney, and there is a formation of the subtest stone of the kidney, that is the uric acid stone. So all the above keeps the person in the greatest risk of the kidney stone. Hope the rationales are very lovable for you all. Okay, and very understandable for you all. Okay, hope the concept is clear. And here is the next question and the last question of the session. Which of the following is the most softest stone? Repeatedly, I am telling this question will comes directly in your exams. Okay, this time, because in the last 2 3 exams there is no questions on the kidney stone. So in this upcoming exams there is highest possibilities of the arising question from the kidney stone. Why? Because in the all renal condition, now the leading condition of the condition or the disease where the nephrologists are getting are the related to the kidney stone. So now the kidney stone comes as a first and the highest incidence disease of the kidney diseases. Because of that, there is highest risk of the possibilities of asking the questions from the kidney stone. Keep in your mind that the softest kidney stone is the our very, very important, yes, our uric acid stone. And the cystine stone is the hardest kidney stone is the cystine stone. And the xanthine stone is the stone where which occurs in the person who is taking the antiretroviral therapy for the treatment of the HIV and AIDS, where there is the antiretroviral therapy which increases the, yes, the blood xanthine level, so which increases the xanthine stone risk. And the Stewart stone and the, yes, the what we call the Strangham stone and the post infectious stone. So this is the what we call the dangerous stone. Okay, so very dangerous is the osteroid. Okay, softest is the uric acid is the softest, and the hardest is the cystine stone. Hope the concept is very much clear for you all, and hope the whatever the explanation I have did in this session, so very understandable for you all. So in this session I am somewhat slow. Why? Because each question containing the very, very beautiful explanation. So explanation needs understanding. For your better understanding, I took this class in the slow manner because there is an highest possibilities of coming 2 to 3 questions directly from this session. So I have took it very clearly, concisely, preciously for your all upcoming nursing officers exam. Students who all are giving your best, okay, who all are giving your maximum potentiality towards your studies, definitely no need to get back, no need to step back, keep back, bounce back, come up, rise up, and yes, let's crack the Norcet. Let's fight. Let's crack the Norcet. Okay. So keep your consistency. Okay. Keep your study continuous. Don't break your consistency. Okay. So thanks for connecting with the master nursing classes. Thanks for watching the complete video. Okay. If you are new to the video, don't forget to subscribe to the channel. And if you found the content are very informative and very understandable, please share the content with your college group, students, your juniors, seniors, and all. Okay. So thanks for believing in the Mr. Nagraj sir. Thanks for contacting with the master nursing classes. So you can join our Telegram group also, where we are conducting the daily dose of the quiz sessions for that is very helpful for all the aspirants. So I will give the Telegram link in the description. You can join from the Telegram link, or else you can visit the about section of my channel, where you will get the all Instagram, Telegram, and WhatsApp link for joining my channels. So we will meet in the next tomorrow in the tomorrow sessions. Okay, daily at the 6 p.m. Okay, so tab tak ke liye jai hind, jai bharat.